And we're talking a Fox Carolina safety alert for you. This is a hot topic with women, perimenopause and menopause. How do they differ and what similarities do they share? So here to answer some of those questions and more, we have Dr. Anita Bajor with Oakview Medical Associates. So let's start with what is perimenopause, and also when does that start? How long does it last? And there's a lot of questions when it comes to this.
Right. So perimenopause, as the name suggests, is the time surrounding the actual menopause. And so perimenopause is when you have irregular, fluctuating cycles, mainly because the hormones are still fluctuating. You know, menopause and perimenopause are a physiologic state, just like we have puberty. So it's kind of the end of the female reproductive cycle where hormones start declining, and some symptoms can overlap between perimenopause and menopause, but the main hallmark is that you have irregular cycles during perimenopause, whereas in menopause you have 1 year of no cycles, consecutive 12 months of no cycles.
So that's the biggest difference maker. When you wonder, like, where am I falling? Am I in that peri stage or am I in full menopause? So it's really your cycle would completely stop.
For 12 months.
For a full year.
Yes.
Wow. What are you seeing when it comes to timeline for women? I know this could be different, but it changes just based on the woman. Is that genetically or is that on your lifestyle? What do you believe?
So it's multifactorial. There's a combination of, your genetics and what age your mother was at menopause. That plays a big factor, but it's also lifestyle driven. It can last anywhere from, it can start sometimes in the late 30s, but typically 40s to 50. Average age of menopause is 51. So it can rage havoc for 10 years prior to actual menopause.
Wow. And with perimenopause, is that something that continues to linger up until you experience full menopause?
Yes.
So it's a full on,
yes,
you got to kind of deal with it.
Right. But, because of fluctuating hormones, I have patients that'll have hot flashes and night sweats and mood swings for a good year or two, and then it settles down. And there are some factors that play a big role in softening the symptoms of perimenopause.
And speaking of symptoms, how can we manage some of those symptoms when it comes to perimenopause and then as we get in to menopause?
So in terms of perimenopause, you can have irregular cycles, shorter cycles, longer cycles, heavier cycles. You can have mood swings, anxiety, depression, irritability, sleep changes, libido issues, vaginal dryness, breast tenderness, urinary symptoms. And there are some rare symptoms which are less common, like you can have joint pain, joint stiffness, heart palpitations, skip beats. You can also have burning mouth and just gums that are more sensitive, ringing in the ears in women. So those are very, there's a big variety of symptoms. And then in menopause, of course, some of these symptoms are really accentuated, especially dry skin. You can have a lot of hair thinning and hair loss. Those are important. You can also go into osteoporosis because we lose that estrogen support in menopause. And the cardiac symptoms can worsen because estrogen has a protective role. So, there's a lot there.
There's so much, I know, as a woman that we have to prepare for and deal with. What would you say is maybe a top 3, if you can give us 3 things to help manage some of those symptoms, whether it's naturally or through maybe even a hormone replacement? I know that's something you have to talk with your doctor about, though.
It's really important that we seek professional care from your physician, your gynecologist, or someone that I'm certified and trained in menopause management. I would say the top 3, actually I have top 10, but I'll narrow it down to top 3, is really lifestyle, your nutrition, your exercise. Intermittent fasting is a very good way to manage. Sleep is really important. Setting boundaries for self-care. I would say exercise, both aerobic and resistance training, very important. And in the hormonal world, there are a lot of options. There are safe options, and of course, with taking into risk and benefit into account. So seeing your physician, and that's really important.
Having those open conversations, that dialogue is so important. I know we'll have to get into more of the hormone replacement at another time, but Dr. Bajor, thank you. I know this is something that a lot of women want answers to. We appreciate it.
You're welcome.